as Susan said, I'm Dr. Shanti Chang. I'm the MSN Division Director in the Mason Online Program, Program Director. If that's a little confusing, just to clarify, we do have an MSN traditional program that has some in-seat options. So if you're like, oh, I didn't know that was a thing, I want to talk to Dr. Chang about that, let me know. But that's not what tonight is. Tonight is specific to our online program. And so for tonight, the agenda, we're going to meet the presenters. We're going to talk a little bit more about our program, including some curriculum things and things you can look forward to as a graduate of Mason. And then just some admission requirements. I think Susan will be the perfect person to get all the details to you for that. And then we'll open it up. This is, you know, quite open, I hope. I'm a pretty approachable person, I'd like to think, and if I don't know the answer, I can reach out to people who do know the answer for certain things. So please don't be shy and ask your questions or you know, make your suggestions or whatever.
Okay, so throughout, feel free to post your questions in the chat box, or actually the question box, and then we can address those either throughout or towards the end. And yeah. Again, my name is Susan. I'm here as an admissions representative on behalf of George Mason, and joined by the program director, Dr. Shanti Chang, who is going to tell you all about the online MSN FP. So take it away.
Yeah, thank you. I am a family nurse practitioner myself and a George Mason alum. I did the BSN to DNP program here at Mason, and then I've been teaching full-time for the past 7 years at Mason, but I'm an associate professor, and yeah, I love it. I'm so glad you guys are here. This is a great place, and I've thoroughly enjoyed reading all of the essays and hearing about all of the passions, and just literally have a smile on my face when I see various things that I think tie in really well with us as a program. So thank you. Wanted to brag a little right off the bat, because why not? The US News and World Report rankings just came out for the year, and we moved up from 49 to number 10 as a master's program in the nation. Our DNP program, if you ever want to talk about that and are thinking about that too, again, that's not tonight, but you can reach out to me and I can connect you with the right people, or at least answer some preliminary questions. But that program was ranked number 2 in the nation, and actually number 1 out of public universities in the nation. So public and private are ranked number 2 with the combo. But we have amazing financial aid programs and lifetime access to Mason's career services. I will also say here, we've got a really active scholarship office in the college that always is looking for nursing applicants. So please Google CPH GMU scholarships and keep an eye on things that pop up there for you guys. Yeah, actively practicing faculty with decades of experience in curriculum informed by the latest research. We are doing a curriculum update right now to align ourselves with the newest essentials. I think that'll be happening over the next couple of years. Every single faculty in our program is active in practice as a nurse practitioner, mostly in settings outside Mason, but then also in our free clinic settings that we have in Mason that we provide for patients who are medically underserved and vulnerable and do not have insurance. So we just went through our reaccreditation from CCNE this past year. It was a big deal. It happens only once every 10 years and was a lot of work, as you can imagine. All those people in here who are familiar with JCO and all those other kind of things. It's a big deal for us, right? These accreditation standards, but we are waiting for the final word, but the site visitors said no compliance concerns. They loved what we're doing, loved the curriculum, loved a lot of the outcomes and the MAP clinics. So our curriculum is really founded on interprofessional education and collaborative core competencies. Like I said, that's, I think, really central, especially to the newest essentials, and we infuse those concepts and others such as policy, ethics, you know, advocacy, just into a lot of what you'll get here in the program. So what makes our MSN program unique? I've kind of mentioned a little bit about the community-focused evidence-based curriculum in terms of the MAP clinics. We do have clinics that are in the community that we go in person for, but then also do telehealth if you're not local to the area. We do target medically underserved populations, but we have a lot of public and population health concepts infused in each of the courses in the curriculum. We're actually the only school of nursing under a college of public health in the state. So I think that it's a pretty unique position to be in, and nursing is certainly at the forefront, and our school is at the forefront of that work. The flexible online format designed to accommodate busy working students. We are very understanding that you guys are juggling a lot in life, work, kids, other family responsibilities, and now school. So these classes are online. Doesn't mean that it's out of touch there, or that it is cold. A lot of the faculty offer synchronous sessions like, hey, can people, log on to Zoom on Tuesday at 7, and then if you can't, then you can't. And you watch the recording and you email your teacher and say, hey, can I talk about X, Y, and Z with you at another point this week? So we also have a pretty prescribed pathway through the courses. It's super organized, just so you guys kind of know what you're going to take and when you're going to take it. So you can plan for life things, or you can plan for a break if you need. Like, for example, those that are starting classes in fall 2024, you will start clinical in summer 25. Summer 2026. So if like, I think I'm gonna have a crazy busy summer that summer, and it's not the right time for me to start in my clinicals, like, that's a conversation we can all have together and adjust your plan of study. The direct contact with the practicing faculty is, again, 100% of us are in practice, and our CCNE accreditation is definitely the biggest, most important thing to us that drives a lot of those standards and competencies drive what we do to make sure that we're offering you guys the best program that we can.
Dr. Chang, when you mentioned the MAP clinic, what is that an acronym for?
Oh, yes, it stands for Mason and Partners. So back to that, back to that kind of first or second slide with the interprofessional and collaborative care model. It started back in 2013 from the current director, Dr. Becky Sutter, and any of you that are here that are maybe Mason alum within the last 10 years would be familiar with it, but started as 2 little rooms in the back of Manassas Park Community Health Center, and nurses and nurse practitioner students just used to go there on Tuesdays and say, okay, if you live in the area and you don't have insurance and you need to talk to a medical provider, show up. But then, as you can imagine, it was just a line down the hall around the building all the time, and it's exploded since then. We now got 10 or 11 clinics, including our own standalone structure in that location. Yeah, and I'm seeing Tatiana here in the chat said it's an amazing clinic. I worked there as MAT as well. So now every day of the week's got a little bit different flavor. We do chronic disease Mondays, and pediatrics, full physicals and vaccines, and TB test Tuesdays, and Wednesdays are our medication assisted treatment for those who have are in recovery or seeking to be in recovery from opioid and substance use disorder. So, and like I said, lots of little flavors, lots of little clinics, but at the end of the day, I always describe it as a win-win, because it's an opportunity for our students who are in need of real hands-on training and real life patient encounters. It's an opportunity for you guys to get that in partnership with your faculty. And then on the flip side, you're working with populations that otherwise wouldn't have that access, and it's completely free. So you're keeping that person out of the ER, for something that they probably don't need to go to the ER for. And subsequently then, tax dollars and deductibles and all the things, all the systems level things that just kind of go wonky from there. But interprofessional, for sure, because you guys work with social workers, you work with undergrad nursing, you work with students who are getting their doctorates in various fields like psychology and nursing. Sometimes we work with Spanish majors. We've got health admin and policy students, health informatics students. So it's just a really, really cool model. And we work with everyone. I would say we're the safety net to the safety net. We work with people to kind of catch them where they're at in these medically underserved communities. That's targeted on purpose to get them to a safe and stable place, and then lift them to other existing safety net health safety net structures like federally qualified health centers or other sliding scale clinics like Inova Cares in the area. So you each will get a chance to do at least telehealth, if not in person, in MAP clinics, and we could talk a little bit more about that with clinical if there are more clinical questions, and I'm sure there will be. But this is just the curriculum kind of at a layout. So you take this, you take these courses kind of in this order as you see here, and the first couple semesters, it's just one at a time for 8 weeks. So first 8 weeks, again, using fall as the example, fall from August 26th to October 20th would be 665, Nurse 665. And then from October 23rd to December 18th would be GCH 500, and so on and so forth. So as you can see from some of the titles of this, of these courses, we really work to start with a good ethical and theoretical foundation to help give you a solid place to build from as you scaffold your learning and journey through the program. GCH 500 is actually also taken sometimes with other disciplines. So this is a requirement of the college in public health. So this is where you would be with, you know, nutrition students and social work students and those health admin and health IT people. So it kind of a cool interdisciplinary lens in project work in that course. Nursing informatics, we focus on some project management concepts as well as nursing informatics, which we all know is just a huge booming field right now. So yeah, I think it speaks for itself in its title there. Nursing research and biostats, a little bit more back to some research and biostatistical assignments and objectives, but with the eye of, I am a nurse practitioner. If I see an issue in practice, you know, I don't necessarily need you to do a bunch of math problems or, you know, a lot of complicated things in SPSS, but I want you to know how to identify a problem, go to the evidence, rate the evidence, look at an article and, you know, don't stop at, oh, well, there was an article written about this, so I'm going to take it. You know, how do you look at multiple sources of evidence in that field of inquiry and evaluate it and judge that evidence? You know, there's levels of different studies and different grades within the levels. So kind of work on that to solve some problems in clinical practice that you can bring to your work as a nurse practitioner after graduation. Organization of nursing and healthcare delivery systems, focus a little bit more on just, I think, systems level thinking with health in our nation, which I think a lot of us would agree could be greatly improved upon. And so our goal is to equip you guys with some of the tools that you can take to graduate and be those leaders and disruptors, as we call it, and changers for the better. But it starts with also kind of understanding, you know, how it all works. And so community-oriented primary care, you focus on, again, public and population health, but in this time specific to as your role as a nurse practitioner in practice. And then 643. So then you'll take a little bit outward, you'll do the 3 Ps ultimately, which are farm, patho, and then physical assessment. So those are 3 separate 3-credit courses where you'll do just that, and you'll learn the 3 Ps, and then you move into this nursing 713 decision-making class, which is, I think of it as then just that kind of final gatekeeper for all of us and for you to make sure, yes, I'm ready to start clinical and start seeing patients and doing what I need to do to transition to practice. And it's putting a little bit of all the above coursework into it. And then you start your clinicals in semester 6. This program is 7 semesters. Start your clinicals in semester 6, and you take family practicum. Don't get confused. It is a little out of order, and you don't have to remember anything that I'm saying now. You've got a student success coach who helps you register for everything. So I hope this isn't overwhelming, but if taken in order, you actually do practicum that is 240 hours first, and then in the second and final semester of clinical, you do 2 practicums in the same semester that equals 360 hours. So clinical practicum total is 600 hours, and then you're doing the didactic pairings with the curriculum with those clinicals as you finish up. So that's the family primary care classes that you see that accompany the practicum. There's one that's just called family primary care, and then the family primary care practicum, but they go together. It is flexible in the sense that, yes, we have a pathway that in a specific order that we like you guys to take these things, but if you're like, I don't know, life's a little crazy, I want part-time, you know, I don't need to meet that 6 credit a semester threshold for financial aid. I can take 3 credits a semester, that's fine. It's an easy conversation to have with Haley Lee, the student success coach, who will be reaching out to you, I believe, shortly after you start in the program. I think it's someone from admissions who initially registers you for your first classes, but then from that point on, it would be Haley. So anything that you have that comes up that you want to adjust your plan of what you're taking and when, that's just a conversation you need to have. Career outcomes. So I will say, we're super proud of this. Board readiness. I think there's a question. I think board readiness wise, I just got the ANCC pass rates for 2023, and 97% of first-time test takers passed it from our school for the Family Nurse Practitioner Board certification. So that is, I think, a good measure of our program being able to adequately prepare you. We do also infuse other external partners, curricular pieces into our stuff. Like you'll do a Sarah Michelle review course in your last didactic, and then this week I'm offering like a Barkley and Associates pre-diagnostic readiness test for boards for everybody all day Thursday and Friday, just for them to take for free, just to see how they might be pacing and what areas they might need to study a little bit more. So yeah, I'm seeing Gabby has a question about, is there a prep course that helps prepare? Yeah, so Sarah Michelle is one of those kind of very popular prep courses, and we purchase that and give it to you guys in your last didactic, like when you're finishing up clinical, right before you're about to graduate. And then also we're piloting this summer these other tests from Barkley and Associates that it's a 2.5-hour test. It's proctored. Like I'll be on Zoom just watching everybody take the test. I've opened it up for all day Thursday and all day Friday for people's schedules to kind of pop in and out as they can. But it's 2.5 hours, and then it's 45 minutes to review what you got wrong, and then areas it suggests that you focus your learning and studying in. As well as I think just our regular curriculum, very much so, is, you know, the tests that you take in the courses, you know, the activities that you're doing, they will all contribute to your learning as how to function as a nurse practitioner, but then also just how to also pass the boards. We know that's step 1 for us. So, but career outcomes here. So absolutely huge demand for nurse practitioners. So glad that you guys are here again. There is typically a bump in salary once you make the nurse practitioner transition, if that's you know, something of interest to you. I will also say there's, besides this list here that you can see these career settings, there's just so many ways to get creative as a nurse practitioner. I mean, telehealth is huge. Insurance companies are hiring nurse practitioners. Like, so I just think there's, especially with this degree as a family nurse practitioner from Mason, we just really prepare you to be able to go into almost any setting that you could want. With that said, when it comes to clinical and your training, I do prioritize you getting enough primary care experience, you know, and focusing on preventative and health promotion matters, as well as chronic disease management and kind of other things like that. So, but it's a little vague, and that's on purpose. It's just so that you guys can make it what you need and want it to be. Maybe I read in some of your essays, some of you are really passionate in certain areas of, you know, nursing, and you already know it and you want to go that direction, and that's great. Maybe others are less certain and they're like, you know what, I don't know what I don't know. I want to keep an open mind. I want to get a little bit of everything, and that works too. And I will say, you have a clinical faculty member directly assigned to you once you're in clinical. So it's not like you're floating around. We have clinical information sessions every semester. Post the recordings if you can't make it. Katie Benitez, clinical coordinator, and me are always available for questions and working things out. But yeah, once you're in clinical, you'll be in groups of like 5 to 6 students per faculty. I text with my group like on a weekly basis. Just anything that comes up. Hey, you doing okay? You know, or hey, my preceptor saw blah, blah, blah today. What do you think of this? So I know it sounds like it's like a big program and you're online, and that could be a little scary because it does require some organization from yourself to stay on task, but it's not like we're just like, okay, release you into the wild. You're free, figure it out. Like, we have a lot of support for you throughout. So went on a little tangent there for career outcomes, but the world is your oyster as far as careers go.
That's awesome. Let's see, Gabby's asking,
Yeah,
what
support
supports?
services are offered. Yeah, so Gabby, if it's like content in a course, the faculty who teach these courses are very knowledgeable, very engaged, very open-minded to have extra sessions or send you extra resources or whatever during the course, if that's something that you need. And if it's like a combination of things, like maybe it's some of the coursework is hard, but also you've got a lot of life going on that's competing with your ability to prioritize school, and you need to talk that out. And what does that look like? We do offer incomplete options for grades. So like, that means if you started the class and you can't finish it, then you have 10 weeks into the next semester to finish up what you need before we give you your final grade for that. So there's always flexibility here. You have Haley Lee, who is a student success coach, and we have her student success coach director. I meet with Reed and Haley and Katie, the clinical team, and Vicky Huff is another name you'll see pop up a lot. She's our admin person in School of Nursing. We meet literally every other week, and we just talk through student situations and like, hey, is there a need over here? Can we put our heads together and make sure we're on the same page over here? You know, we just stay really connected with each other. So I don't know if that speaks to, Haley is usually your first go-to person for, hey, something's happening in this course. I don't know if I'm going to be able to pass or move on. What do I do? She will either then pull me in, you know, if it truly is just like a course problem, like you're not getting the content, the faculty are amazing. We do have doctorate students that, we have the graduate nursing organization, which is completely open to you guys too. It's open to masters and DMP students, but a lot of times there too, they have additional support and resources. I know they have a mentorship program where they pair doctorate students with those that are maybe in the beginning parts of their curriculum, of their program for curriculum help.
That's amazing. All right, so there's a couple questions. Helen, do we work with NPs for our practicum? Can we work with MDs?
Yes, love that question. I don't limit, I want you to go with everyone. I want you to get a good experience. I want you to see how everything's done. I mean, I love the idea of you doing at least one little stint with a nurse practitioner, just so you can, in addition to seeing the patients that they're seeing, but see what that role looks like in practice in certain settings. You know, ask them about the ethics of things, ask them about the legal aspect of things. Those are all concepts that can pop up on your board certification. But I don't require you to only be with nurse practitioners. You can be with MDs, DOs, PAs, NPs. I've even had some people request about certified midwives. That area is a little bit more gray. If you can give me their credentials and their experience and if you can give me an idea of what you'd be doing together in your time, then I just, you know, evaluate Katie, the clinical coordinator, and I kind of say yay or nay. But at the end of the day, like, I really am open-minded, I think, to your passions and your needs. So if that means that you're like I had one student, for example, who really, really, really wanted to do hospice. And we considered hospice prior to her a specialty where you can do specialty, like you can do inpatient oncology, sure, but I can't let you do all your hours in inpatient oncology because it doesn't meet the primary care definition that we need to meet for our program for you guys, as this is an outpatient NP program. But the student she was told, oh no, you can only do 100 hours in hospice, it's a specialty, sorry. But she wrote a beautiful long email to me, and I passed it on to the person who was the director to before me, and she just made a great case for why it was primary care. And this is part of the stigma of hospice, and this is part of the problem. Like, more people need to think about hospice sooner, and you know, quality of life matters and everything sooner. It shouldn't be a specialty because we're all going to die someday. So why not expand our curriculum and our willingness to allow our students to spend a little bit more time in that setting with those folks. So I was like, yeah, that makes sense to me. Sure. So the director agreed at that time too.
So Dr. Chang, so are you saying that if somebody wants to do a specialization, the minimum hours in family practice has to be 500 and they have
Correct.
100? Okay.
Yep, they have 100 to play around with. And those
Gotcha.
100 could be specialty, or it could be, we also allow for up to 100 non-direct patient care clinical hours. So let's say that you have found an awesome family site that sees kids and grown-ups and some geriatrics, but you're not getting nearly as much women's health as you thought you would, or men's health, you know, that's oftentimes overlooked as well. I think using those non-direct hours is a way that you can still get credit for your effort. If you were to find some CEUs in some areas in women's or men's health that you felt you wanted to take to round out your knowledge, you can count those as non-direct clinical hours as long as you get your faculty's permission. They almost never say no if you can say what you want and why you want it. If they're unsure, they ask me, and I kind of just ask, what do they want? Why do they want it? Okay. So, you know, I know it's clear as mud sometimes when it comes to clinical, but it's really to benefit you guys to be able to build your time in this program to be the best nurse practitioner that you can be. And another clarifying point on clinical, you do, in a perfect world, take clinical over 2 semesters. Again, if you need to break that up, like there are options, but just for simplicity's sake, it doesn't mean that you only have to go to one site the first semester and another site the second semester. If you find 2 preceptors and sites that are willing to take you in the same semester, and you can divide your time and organize it between their schedules and yours and your work schedule and your family life, that's fine. Like, we have some students that even go to 3 sites a semester. So don't be afraid to kind of keep on looking for multiple places, even if you've already got someone who's said yes to you. It's not a bad idea to have another option. Or maybe they say yes, but I can't take you in the summer, I can take you in the fall. And you can say, great, yeah. So it's all a game of puzzle piecing together. But again, we go a lot more into clinical in our clinical information sessions too, which we'll have one in about a month actually. So
does it have to be at least 2 different sites though?
No, so that's a good other side of that coin. If you are at a family practice that you feel like they do everything. I had an amazing family physician preceptor when I was in school, and she used to deliver babies, but she didn't do it anymore. But she did small babies, she did kids, she did adolescents, she did PAPs, she did, you know, simple gynecologic procedures. She didn't do prenatal visits, but you know, she did STI testing, family planning counseling. She did, you know, substance use treatment, anxiety, depression, regular, just like kind of chronic care management of diabetes, hypertension. She did some geri and dementia care. Like, she did it all. And so I went to her my first semester of clinical. At the time in my program, clinical is 3 semesters. And then I went back in my 3rd for her again. So there's no like minimum hours that you have to spend or in any one population in primary care. Like, people often ask me, well, do I have to get 100 hours in peds and 100 hours in women's health? We don't define it like that. Again, it's clear as mud, but you work with clinical faculty to make sure that as best as we can, that we're helping you get a well-rounded experience. And again, our MAP clinics are good ways to round that out. Like, let's say that you really want to do peds, but you're having a hard time finding a pediatric, you know, or adolescent medicine site. We can then get you into our pediatric and adolescent clinics in the MAP clinics. We've got, you know, our Manassas on Tuesdays, and then we've got one clinic that's co-located in the largest central registration building for Fairfax County Schools, at their central registration center in Dunbar, in Virginia. So, and they just do all peds. They do all the shots, they do all the TB testing, we do a ton of sports physicals. So there's a lot of ways that, again, MAP Clinic can kind of help you. We're doing now STI testing, HIV testing. They're not doing PAPs right now, but that's another reason that we stand for Mason Partners, because we're always trying to make more connections with other people too, to continue offering as many and best services as we can within Gleason. So
Wonderful. Jessica's asking, is there assistance with clinical placement? Has there ever been any issues with students securing sites?
Yeah, good question. So this is a very commonly asked question. Again, with finding clinical site, we start the conversation early so that you know what you're getting into as soon as your courses start, and some strategies for success. Ultimately, finding the site is up to you. But again, we have support and the MAP clinics to fill in and supplement as needed. So I start with kind of giving you guys, Katie and I start with giving you some tips and tricks in your first couple semesters. Hey, here are ways to talk to people, here are things to say, here's how you can ask, here's ultimately, if you're like, yep, I've tried all that, nothing's happening, can't find anyone, Katie will give you a list of people in the area that you live in. If we've had a student in that area before, she'll give you a list of some sites that people have gone to, so you can target those sites to say, hey, I understand you took a George Mason University student before, I'm also in that same program, would you be willing to take me on? But I wouldn't say, we've never had anyone not finish the program for lack of clinical site. Military hospitals, yes, we can do that. I think there was another question about State Department and other countries too. Just keep in mind with like State Department and military, sometimes on their end, they have additional contractual needs and eligibility criteria that we all need to pull together and speak to. So just if you think that that's the way you're gonna go, communicate that to us. Usually maybe when you start patho and farm is a good time to just make sure that we're super clear. And again, there's a very clear process. You submit a preceptor data form. There's a checklist where you can see like, okay, I submitted my form. Where am I at in the process? Like, has the contract been signed? Okay, has my Castle Branch stuff for my own TB and immunizations and all that been approved? Like, there's a really transparent place for us to communicate to you. Ultimately, worst case scenario, if you're like, yep, due to start clinicals in summer, couldn't find a site, don't live in Northern Virginia, can't get myself to the MAP clinic, we'd probably say, okay, just take a pause for this semester then and keep working on it and jump in fall. And then it just pushes your graduation semester.
And what would you say to people that are applying outside of Virginia and Maryland for practicums?
So same thing, we have students at this point, we've been around for a few years, so we do still have lists in other regions of the country. We have, at this point, I feel like we've had students in clinical. You know what? No, New Hampshire's been tricky. So if you're from New Hampshire, I'm sorry, but I think I was looking at the list of admits for fall, and most of you guys are from Virginia. But there is a couple Georgia, maybe a couple North Carolina, like we had a fair number of students in those states as well. So the process is the same, regardless of what physical location you're in, geographic location you're in. You know, you do your best. Oh, I will also say Minute Clinic counts as well if you want to do some like Minute Clinic or some other thing like that. So just Google CVS Minute Clinic Nurse Practitioner Preceptorship, and it'll pop up like careers, you know, something, it'll be the first thing. Click on it and scroll down in the middle of the page. It'll say nurse practitioner practicum, like an eligibility criteria, and it gives you all the dates. And they take people on 3 times a year. We have a very good relationship with them. I know the Amy Wagner, the director of like the placements and everything for Minute Clinic. She always tries to get our Mason students in, and that's all around the country, you know, so keep things like that in your mind open to, and get that, maybe all of you Google tonight, you know, Minute Clinic, when is my application due? Again, if you guys are starting clinical, if you're starting courses in fall, then you'll be in clinical summer 2026. So you just want to make sure then headed into that summer 2026 semester, you've got your application, everything you need in for the minute clinic. Just as like a safety. So, but Katie
That's
has
great.
lists. Yeah, Katie has lists of places in other areas too, but we request just because of, you know, volume and everything, just support that everybody just do their best to put in a wholehearted effort. And that doesn't mean that you're alone in your efforts, but we can talk about other options if it's not playing out the way that you want it.
But that also allows you to be placed where you want to be placed on the flip
Absolutely.
side of it, right? It's not like
Absolutely.
you're being placed in a place that you don't want to be, you know,
Yeah.
or super
Yeah.
far away.
Right. Yeah. And we've had a lot of students recently, I should probably bring this up too, ask about the payment services. There's a lot of those popping up that are like, hey, if you pay us $4,000, you can get 200 hours of clinical with a preceptor. We don't forbid it by any means because, hey, it's you and your money. If you want to and need to go that way, that's fine. Mason, contractually and legally, we can't be the ones to pay for that or have that in our contract language for you. But I do know some students who have done it and they've just paid on their own, you know, on the side. And it's been okay sometimes. That is really a situation, though. I bring this up because, to Susan's point, I mean, honestly, more than not that many students end up needing to go down that road, quite honestly. But the couple that have, and they said, I'm exhausted, I'm just gonna do it, I'm gonna try it. But more than half of them have not been very happy with the experience that they've gotten. So, but then they also feel like they can't walk away because they've just spent thousands of dollars on this placement. So, we do have, like they said, the MAP clinics. We have like telehealth options too. And for that substance use clinic, that MAT, there's telehealth for that. We've got PMHMPs running that with peer recovery specialists and family nurse practitioners. So interdisciplinary team, telehealth all day on Wednesdays. And then we've got evening telehealth clinics at least 2 nights a week. It's 2 nights a week this summer. In the spring, it was 3 nights a week. So there's also options for you if you're not local to the DMV area for us to help you get clinical hours and experiences in.
So Catherine is asking, is there a specific guide that states how many hours are needed in specific fields relating to clinicals?
Yeah, I'm sorry. This is, one of those, it's a great question that I get asked all the time. It's 500 hours. This is why it's so ambiguous. When you take boards and when I'm signing your form saying, yep, they did what they need to do to be able to be eligible to take boards. You know what the eligibility language says? That I'm verifying that like at least 500 direct patient care hours have been spent in time with populations that you will serve. And I'm like, that's vague. Okay. So I look to the standards for nurse practitioner criteria and within different populations, and I look at some of the competencies and skills that you need to get. I don't personally think that skills and competency are a number thing. Like, I think that you know better, and your clinical faculty, who's got 5 of you in their group, is going to be able to come to a better decision on what you need and where you need to focus on to round out better than I can tell you black and white at this point. Some of you guys have amazing school nurse experience or a lot of peds outpatient experience already, and maybe you don't want to spend much of your 500 hours as a provider in that setting because you already feel like, yeah, I got a pretty good idea. I do triage nursing for a pediatrics office. Like, I don't need to do 120 hours of pediatrics. I want to see how I like, you know, medication assisted treatment, you know, or I want to see how I do, with folks, you know, who've got longitudinal chronic care issues. I want to go to a clinic where I know I can go there most days of the week and I'll be able to see the same patients over and over again to learn about the management of something over time longitudinally. So it's just, there are no clear-cut numbers other than 500 direct patient care hours in what I define as primary care, and women's health and pediatrics doesn't count as specialty. That's primary care. So you can go to an internal medicine, you can go to a fast track ER, you can go to urgent care, you can go to a health department, you can go to minute clinic, you can go to a family practice, internal medicine. yeah, peds, women's health, all of those are primary care settings, and you just need to get 500, and then your clinical faculty will work with you. Like I look at my students' case logs every week and I say, looks like you just, especially if we're headed into the second half, like, looks like you've been focusing a lot on, geriatrics thus far. Do you think you're going to have any opportunities to see any peds or adolescents? And if they're like, nah, not really my thing, I'm not really interested, I might say, okay, fair enough, but you are being certified as a family nurse practitioner, so I have a responsibility of making sure that you've got at least some level of comfort and safety with those populations, and we'll be able to pass boards for those populations. So why don't you, let's get you into our MAP clinic next Wednesday, or do you want to go do that sports physical event on Saturday with another faculty who's doing sports physical all day or something like that? Just like, so you get at least little flavors of things to round yourself out.
Okay, thank you so much.
Mhm.
Jessica's asking a great question. Can you explain a little bit about what we should expect out of our clinicals? Is there something we provide the clinical site to show what we should be learning and seeing?
Mhm.
Do we shadow our clinical instructor? And by the end, are we seeing patients on our own,
Yeah,
etc.?
we're really getting into the nitty gritty here,
Yeah,
but
wow.
yeah. It's a good question. Yes. So like, for example, I've got a clinical group right now that have just started clinical this summer. I've got 5 of them. I meet with them. I get all of their preceptor contact information. And as soon as I know they're starting clinical, I send a message to that preceptor saying, hey, my name is Shanti Chang. I am the clinical instructor working with student A. Here are some resources that you might want to use to help you, as well as the course objectives. It's like a little preceptor packet. It's got little pearls on like 1 to 2 minute preceptor tips on how they can phrase feedback for you. And this is all evidence-based, this packet is because when you ask people their main reasons for not wanting to precept, obviously a high reason is time, that it takes a lot of time to do it, but that's actually the second biggest reason. The first is they want to make sure that they are adequately prepared and going to do a good job in their role. So this preceptor packet is structured to be able to give them that knowledge, and or they have my number and they can talk to me and we can figure out some strategies on how to best give feedback and work with their students. You use a system called Typhon to document your hours and your case logs. So I ask that you document 1 to 2 patients an hour. And within those case logs, you specify the level of autonomy you had in that patient encounter. So in the beginning, sure, I absolutely expect it to be a little bit more observation. Like you're not going to show up the first day and be like, I'm here, let me do everything with you for your patients. But over time, I would hope that I would start to see that observation would turn into like, okay, yeah, I did like 25% and then 50, and then I did it mostly by myself and just reported back. I mean, just to be super clear, you guys are never allowed to be with any patient without adequate supervision from a licensed provider. And then also, on the other end, observation only experiences are not allowed. Like it's gotta be, you can observe in the beginning at your clinical site, but then at that site with that preceptor, you have to be able to speak with a patient, and or even if you're not the one conducting a lot of the encounter, like at least then your preceptor needs to ask you about the differentials or the treatment plan and pick your brain with that patient, prior to going back into that room. So it's still got to be a learning experience where it's not just a person talking to you, telling you what to do all the time. As you can imagine, that wouldn't make you a very good nurse practitioner.
And y'all have
So,
very good pass rates too on board.
yeah,
So y'all,
exactly.
yeah. Okay, so Alyssa's asking, I know you said there was an option to go part-time if needed. What would be considered a part-time student? Do people often start full-time and transition to part-time?
Yeah, it's a good question. So I'll be honest, the part-time and full-time thing always throws me a bit. And I know you guys are all asked to choose which one you want when you apply. The courses are offered 3 times a year. Every course is pretty much offered 3 times a year. So for you, part-time can be defined how you want it to be defined. Like if you're like, I can only take a course in the beginning of the fall semester, then you're just going to take 665, and then you might wait to take GCH 500, the next course in the line, until the following spring. Until spring 2025, second half of the spring semester. So it doesn't have to be like super black and white, because we offer the courses so often. So I think that that's a nice thing that gives you guys a lot of flexibility. With that said, most people do it pretty much one course a session, because we purposefully organize this program keeping in mind that you guys are really busy and juggling a lot of things. So we, for the most part, especially in the beginning, only offer one course at a time. So up until you're in Patho and Farm, you're only ever focusing on one class content every 8 weeks, if that makes sense.
Yeah, because the semester is 16 weeks. So what you're doing is
Correct.
the first class,
Yeah.
the first 8 weeks, and then the second class, the second 8 weeks. So even though you're completing 2 classes a semester, you're just focusing on one at a time.
Yeah.
Can
I
I
have actually a plan of study that I could even bring up and show if that would be helpful, but
oh, that'd be
I know we're
awesome.
also kind of running over time too, and I want to be mindful of people's time. But were there other questions too? Maybe we can loop back to it.
Yeah. Well, I just wanted to clarify for the students. So a
Sure.
lot of students are working full time, and then some aren't. But when they get to practicums,
Yeah.
what would you suggest?
If I'm being really honest, it is
Be honest.
very hard to work full-time while in practicum.
Mhm.
And that's because usually you're at the mercy of the preceptor schedule. That's not because like we've put so much on you. It's because you're trying to juggle your own life and work, plus this other provider or 2 or 3 providers schedules, which has to be a priority. So really when you're in those practicum semesters, like if you needed to space out the didactics, like you're like, I really can't do the classroom part of this semester, but I'm going to try to focus on the practicum, but can I do the classroom part after? Like, again, we can break them apart if we have to, but when you're in that practicum semester, you have that semester to do those hours. And then if absolute worst case scenario, you need to take an incomplete and take 10 weeks, which is 3/4 of the next semester into the next semester to finish it up, then that's what we do. So I've never had anyone fail or like not finish the program for clinical drama. Do some people take a break in between clinical semesters, or maybe a break prior to just starting the last 2 clinical semesters? For sure, once they realize like, oh, actually, yeah, if I'm to space this 600 hours out evenly between the 30 weeks roughly of that I have to do this, that's about 30 hours of practicum a week once you're in those semesters. So keep that in mind. Maybe you take a break for a semester or 2 prior to jumping into that, and you work a lot to build up some cushion, for you to financially be able to take that on, so that you don't have to have such competing priorities. I mean, obviously we all have to have food in the fridge and roofs over our heads. So there's no judgment there. That's why it's flexible. Like if you need to take a pause from clinical to get everything in order to be able to do clinical, then we can work with that for sure.
Okay. And I did want to mention that we do allow up to 6 years to complete the degree.
Yep.
Yep.
Exactly.
So, okay. So how can I improve my chances of acceptance into the program with an undergraduate GPA of 2.79? I have 10 years of experience at a level 1 trauma hospital. Are there any successful precedents of applicants with a similar GPA being admitted? And what steps can I take to strengthen my application, considering the minimum GPA of a 3.0? Additionally, how effective is a GPA addendum in such circumstances?
Yeah, I love that question.
Yeah.
I was just telling Susan actually earlier, I struggled through my BSN program, but I also feel like I was a different person back then. I've grown and matured, and in some ways I'm still working on it a bit, right? But
love it.
But I think my bachelor's program was probably the time that I like cried most in life and was so confused.
Oh my goodness.
No, yeah. So personally then, and because the binding review does come to me for decision, would I like to see in an application, if your GPS was less than you'd want it to be, less than, you know, we put 3.0, but we don't prohibit anyone from applying who's lower than that, and for good reason. If you want to make your application, I guess, speak to a level that would be enough for me to say like, yeah, I don't care about that, is kind of what you just put in that prompt. Like, yeah, I acknowledge that it wasn't as great as I wish it was, but I've grown and I've worked 10 years, and that includes time in a trauma 1, and I've really had time to mature and hone in on, you know, different studying practices or whatever. Just even my passion for nursing, you know, really propels me, and I know that I'll do well. I think a lot can be just justified, I guess. I don't know if that's the right word, but a lot can be justified and described in your essay. Use that as, if there's something that you're not proud of on your transcript, or like maybe something happened in life, you started at a school, you didn't do well there, and you had to stop and you had to go to another school, like because you had a lot of life going on. If you're comfortable, it's no pressure either, but like if you're comfortable and you want to speak to it, even generally, like use your essay as the space to speak to your resilience and ability to rise above, and be better, and just kind of state why you want to be a nurse practitioner and make this work, and why you think you can. So we don't have any official caps on our admission numbers, just FYI, currently, so that's good. We do still maintain small class sizes, though. I like to keep it at like 24 per class. Students, so that you have a real, you know, connection with your faculty and those other students in your class. But I think that's always nice to know too, so you know that you're not like competing really hard, I guess, against other people, because I think we really prioritize, we recognize the need for more primary care providers to get out into the world. So we've got a great program, we've got the resources and the support to be able to get you guys out there in a successful way to do what we all need to do, and that's our goal.
Yep, that's wonderful. Okay, let's see, admissions. Dr. Chang and the admissions committee look at the person holistically. They look at your work experience. Just submit strong supporting documents. But myself and my fellow enrollment counselors or representatives are very happy to assist you in the application process. I usually tell my students that I'm your personal assistant along the way. So, but the application process is super easy. We do accept unofficial transcripts. We will attempt to order official transcripts on your behalf. Of course, a resume. Oh, 3 letters of recommendation. I thought it was just 2. It's 2. Yeah.
Yeah,
It's
it's 2. It's 2. Yeah. Sorry, I missed that.
Into the application portal, they receive an email that takes them to a link, literally takes them 10 minutes to do this questionnaire. If they want to add something in writing, they can do that as well. And then, like Dr. Chang said, the personal statement, that's really where you tell, you know, speak your truth and why you want to do this and why you'd be a good candidate. And of course, you do have to have a BSN and an active US RN license and at least 1 year of experience as an RN and a current CPR card. So yeah, so the application process is very easy, and I'm just gonna, if you don't have an admissions representative, feel free to reach out to us. And there you go, there's the information. And we're happy to assist. That's what we're here for. Any questions? Oh, do the letters of recommendation need to be from people in the medical field?
Yeah, that's a great question.
That is an excellent question.
Yeah, I think we usually ask that at least one be from someone who is in a supervisory position to you somehow. So yeah, ideally clinically would be great, but maybe some of you haven't been at the bedside in a long time. That's another thing, then fine. If it's your supervisor and you're in an administrative position currently, then that's fine too, but then use your personal statement to tell me then too, like acknowledge again, like I realize I haven't been at the bedside in 5 years, but this is why I want to get back into it and become a nurse practitioner. Because sometimes I read these essays, or you know, I see certain things, and sometimes it makes me think like, oh, okay, yes, I want them for this program. They'd be great, I'm sure, but also given what they're saying, maybe they should go to like our leadership DMP program. So I just sometimes also I'll take notes myself, given what you've said and what you're writing down, and I might reach out to be like, hey, got your application for this, but also, once you accept, if you want to talk about transferring over here or want to learn more about that, let me know. So we do have a few programs and pathways in our school, and we all work super close together.
Great. Now, Gabby's, hey, do we have an application fee waiver? I wish.
Yeah, so, no, not right now,
Okay, that's what,
unless,
yeah.
yeah, I don't think there's any like official one right now. With that said, like, if you're like, look, I want to come, but finances are an issue. I really want to apply, but $75 is $75 is
Yes,
like a big
$75.
deal. Yeah, it's not like a little amount. Like I wish they would just go away altogether, right?
Amen
But
to that. Amen to that.
yeah, I mean, just
Yes.
send me an email. I can always have a conversation with my directors in the college and say like, hey, is there something we can do about it? I mean, I guess I should cautiously say that because now I don't want like everyone emailing
Oh
me,
my
but truly if
goodness.
it's, if it's, yeah, I mean, I don't know. And I say that not
Oh
knowing what
man.
control I have whatsoever, but, so we do not have interviews at this time currently. We're waiting the interviews for applications, and then, 2 supervisor letters are fine. You do
Yeah.
not have to have one from a professor. I would just say again, like seeing if you could use it, in a way to, I guess, look at it as like diversifying your application. Like I really do love holistic applications, and I want to see, like, I don't care just about your math grade or your GPA or whatever. Like the essays are my favorite. I'm totally biased, but I want to see kind of your experience, and yeah, letters from a supervisor, and then maybe someone who's worked with you clinically, or maybe in another setting, that you didn't get to speak to as much. So just use it as an opportunity to kind of showcase yourself, if that makes sense. 1 year bedside experience, that's fine. We define the 1 year as 1 year at the time of starting classes.
Which is
So,
great.
yeah.
Yes. Okay.
But with that said, we want you to have some good nursing foundations under you as an RN, because it is a rigorous program. You're getting a nurse practitioner degree to be an advanced level provider. Like you're gonna have prescribing and treating all these things, expectations on you. So we just want to make sure that you'll be the best and safest nurse practitioner that you can be. So, but
Absolutely.
again, I don't think that time always, like numbers don't meet that definition always. There's other ways of demonstrating that. So
Mm-hmm. Now, Tatiana wants to know if she could email you about the BSN to DNP program.
yes, if you are interested in the BSN to DNP program and you want to email me, I can pass you on to that program director. It's Dr. Andrea Landis. Also throwing out there, we do have other NP programs besides FNP. So we have a BSN to DNP FNP, but then we also have an adult Gero NP BSN to DNP, and we have a psychiatric mental health nurse practitioner BSN to DNP. And I actually just finished that postmaster's psych certificate, and I will be taking my psych boards this summer. So wish me luck, everybody.
Oh, wonderful. That's so cool.
Yeah.
All right. So Tatiana says she loves Dr. Landis.
Yeah,
So there
Dr.
you
Landis
go.
is amazing. Dr. Landis is the program director for the FNP and AGMP DMP program, whereas I'm your MSN, especially Mason Online person. We do have an MSN hybrid program. If any of you decide like, you know what, I don't know if this 100% online thing is for me, I think I would benefit from some face-to-face time. Our hybrid programs online, most of it, I would say, but it's a little bit of a different layout, and it is more, you come to campus every once in a while for some things. So we could always talk about switching over to that one if that's something you're interested to. Just send me an email and you're like, yeah, I like this, and I'll connect you with the right person.
Can I clarify? So you're saying the campus MSN FP is a hybrid?
The campus MSN FNP is a hybrid.
Good to know.
It's
Okay.
not fully in person. So a
Okay.
lot of those classes, the level 1s are all online. Half of the level 2s are online, and then the other half are half online and half in person. And then for the level 3s, they go in on campus every other week.
Okay.
So it's really not too much, but then, you're seeing people face to face. So any on-campus intensives. We do not require on-campus intensives right now. I've heard some feedback for some people that that's something they'd be interested in and want the opportunity to, which I would always love to talk about. This just came up at a faculty meeting last week, actually. So we're considering it. We kind of got to get our ducks in a row to see what that might look like. I think an alternative to that, honestly, is that we've almost kind of got a built-in version of that already with our MAT clinics. So if you're like, I want to go and be with faculty and be in the clinics and see patients in real life with someone at the school or multiple people at the school and see what this looks like you could fly in or drive up, you know, for a couple days in a row. We could get you in clinics Monday, Tuesday, Wednesday, back to back. And in on Monday, Tuesday, Wednesday at Manassas, you could see chronic disease care. Then on Tuesday, you could see pediatrics and adolescents, and then on Wednesday you could see substance use disorders, all side by side with, you know, faculty at Mason, nurse practitioner faculty, and then that would be a nice time for us to assess and give you pointers on some skills and assessment things, if it was of interest to you, but not required.
Cool, that's great. All right, so I think we are at that bewitching hour. Am I? Yeah, 8:03.
Yes.
Thank you
I
so
always
much.
could talk forever and ever. So my email is schang13@gmu.edu. If anybody else has any other follow-up questions for me. And like I said, if I don't know the answer, I can at least hopefully point you in the right direction. But yeah, your admissions counselor also is obviously a great first person to go to as well.
Yep, we're happy to help. Thank you so much. Now you see why they're rated number 10 in the nation?
Oh, I can't take credit for that. No.
Sure you
I
can.
actually,
Sure you can.
no. Yeah, no. Yeah, it was me, of course. No, honestly, when we do those reports, I was just talking to someone about this. It's the students. I love the student the student information that we get to brag on, about who our students are coming into us and then who they are when they're leaving us, and just everything that they do in the program to get there, and the experiences that you guys bring into our program and that we all share with each other is just really, I think, what makes us unique and special and excellent. So thank you guys.
Yeah, thank you for joining us. And Dr. Chang, you've been so informative, and this has been wonderful. And
Thank you guys.
thanks for all your great questions.
Yeah.
So again, Dr. Chang just shared her email, and be sure to reach out to your admissions representative, and we're happy to help. And thanks again for joining us.
Yeah, thanks everyone.
Bye for now.
Bye.
Bye.